Pranya, how are you today? I went to uni today to attend my mock OSCE exam, and then after that I went to the gym. At the moment, I'm having spicy pasta salad. I made spicy pasta salad after I got home from the gym. I went to uni first, attend my mock OSCE, my OSCE exam, which is will be next Tuesday, my OSCE exam. So we have mock OSCE today. And then after that, I went to the gym. During the mock OSCE today, the tutor said, what I have done is a pass. So I would like to share with you why what I have done in the mock OSCE today. She said, my tutor said it was a pass. So I would like to share with you today why during the mock OSCE today I have got a pass marks. First of all, OSCE is your new chart exam, your ABCDE exam, and also your S bar tools exam. So first of all, you have to know how to do the observation ABCDE on the patients and how to use S bar tools to escalate if any concern about the patient. Even the new score 0, even when the total new score was 0, but if the patient so anxious and said she's so worried that she's in so much pain, you still have to escalate and inform the doctor that your patient's in so much pain, although her new score is 0. So today the situation, the scenario was we have a patient, the female patient, been admitted to the hospital to have her sebaceous removed from her neck. She was admitted yesterday to the surgery ward, and today she had her cyst removed from her neck. Her sebaceous cyst removed from her neck 2 hours ago. 2 hours ago, under the local anesthetic. So at the moment, the patient is at the day surgery unit after she had the cyst removed from her neck 2 hours ago. 2 hours ago, under the local anesthetic, and she's now is being transferred to the surgery day surgery unit, and then your nurse in charge come to you, ask you to go and do the observation ABCDE on the patient, and then escalate to her if there is any concern regarding the patient. Your patient looked fine and she passed urine after the surgery. So when you go in to see your patient, she was lying in bed. You ask the patient to confirm her name, her date of birth, and she can recall to you. She can tell you her name, her date of birth correctly. But before you ask that, you introduce yourself to the patient first. Before you go in, before you do anything, before you do any observation, first of all, before you enter the room, first of all, when you enter the patient room, you check if the area in the patient room, if there's any obstruction, that will any hazard that will prevent you from perform the observation on the patient. If there wasn't any potential hazard, the area is clear, then you can continue do the observation on your patient. Then you gel your hand, put the PPE on if you needed to, but in this scenario, your patient has not got any infection and you will not be touching any bodily fluids. So you don't need to put PPE on, but you still need to gel your hand. So once you gel your hand, you close the curtain, give patient privacy and dignity. You go into the patient and then introduce yourself to the patient, who you are and what you want to do to the patient, gain consent. When the patient say yes, okay, do what you need to do, yeah, and then you start with checking the respiration on a patient. But before you checking the respiration on a patient, you recall saying, my patient airway is patent. She can tell me her name and her date of birth correctly. Then you checking patient name back, patient wristband to see if the name was correct for what she told you, her name and her date of birth. So check her wristband. If her wristband matched what she telling you, and then ask her, you could check her respiration. This is part of ABCD. A and B is respirations and saturation, and also airway and breathing, A and B. So you check respiration, you check oxygen level, saturation, and you also check if patient breathing on room air or on oxygen. So first of all, you check patient respiration. You ask patient if it's okay for you to check her respiration. If you're not sure, if you can't see patient chest moving up and down clearly, you can also ask patient if you can touch her chest to feel her breathing, yeah, her respiration. Sometimes when you touch the middle of a patient chest, that can help you count patient respiration correctly. And then after you do that, and then her respiration was 12, so you recall that number out saying my patient respiration was 12. According to Royal College of Physicians, her respiration is fall in a normal range, 12 to 20. And then you move on to check patient saturation. You ask patient, is it okay if I check your saturation? Is it okay I put sat probe on your finger to check her saturation? Your patient say yes, and then you say thank you and put probe on her finger, and then saturation was 99, so you recall it out saying my patient saturation is 99 on room air. Yeah, so you then note the respiration rate and saturation on the new chart. And also note on a new chart as well, patient breathing on room air. Then you next move to checking patient blood pressure. You ask patient, can I check your blood pressure? And then patient say yes, then you check her blood pressure. In this OSCE practice, you will be using a stethoscope to listening to patient blood pressure. You will be manual checking the blood pressure, so you will learn on how to use stethoscope to check patient blood pressure. So first sound, that is a high systolic breathing, and the second one you hear like the second one that is a dystolic, and after that you will not hear anything. So you hear twice. First you might hear the first, that is systolic, and then you continue hearing the beeping until the last sound, and you not hear anything afterward. that is dystolic breathing. So and then you record patient blood pressure 125/85 on the new chart. This one you're using arrow. Any other thing else you use dot, but the blood pressure you're using arrow. Then you move on to check patient pulse. You do the manual counting patient pulse. You can consent our patient if you is it okay if you touching her hand and to check her pulse rate. And when the patient said yeah, then you continue counting the pulse rate on patient arm, and then her pulse rate was 71. So then you recall to the patient, your pulse rate is 71 according to Royal College of Physicians. Your pulse rate was normal, falling on the rank of 51 to 90. Yeah. For the blood pressure, her blood pressure was 125/85. You can also need to recall it out to the patient and to the examiner that my patient blood pressure is 125/85. According to Royal College of Physicians, the blood pressure fall in a normal rank of 111 to 140. I know sometimes above 140, patients still score 0, but we tend to believe anything above 150 or above is hypertensive. So we need to report it if patient blood pressure is any higher than 140. Move on to the level of consciousness. You now need to ask patient, do you know where you are? Can you tell me which ward you are? Then patient tell you where she is, which ward she is. Then you can recall out, say my patient is alert. She can tell me where she is and which she know where she know where she is and she know which ward she's in. Yeah. And then after that, you check the exposure, which is E, temperature. You then ask patient, you say, okay, if I check your temperature, madam, patient, yes. Yeah. Then you ask her if it okay, you put the probe, it's okay. Is it okay you put tympanic inside her ear? She said yes, then you do so. And then after that, after you check her blood, her temperature, so after you check her temperature, you dispose the tympanic probe in the bin. Yeah. Clean the tympanics and then you recall it out to the patient. Your temperature is 37.1. According to Royal College of Physicians, 37.1 is classed as normal. It falls in normal rank between 36.1 up to 38. Blah, 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 blah. Yeah. So basically you check A, B, C, D. A and B is airway and breathing. C is circulation, which is blood pressure. And then another C is pulse rate. It's also part of circulation. Yeah. And then D is consciousness, level of consciousness, which you got ACPVU. Yeah. A is alert. C is confused. P is respond to pain. We respond to voice and use unconsciousness. And then you got E is exposure. Exposure is temperature. If patient exposed to any infectious or anything, or maybe during the COVID, you will get check your temperature before you enter the hospital because temperature is they check for the exposure in case you been exposed to the COVID-19, So before you enter any area, they check your temperature first. If you remember during COVID, you know why we check the temperature to see if you have been exposed to any infection, any diseases, Sometimes the temperature can tell. During COVID, you got high temperature, you will straight away need to have your lateral flow checked, to see if you got COVID or not. And then you told her the new score, patient score 0. So when the patient score 0, you still continuously monitoring the patient blood pressure at a minimum of 12 hourly. So then you move on to fill in your S bar chart, and then you report the situation to your nurse in charge. The situation is like me. My name is Varanya. I'm a student nurse. I would like to escalate about my patient, Mr. X. Mr. X, yeah, he's the patient had a removal of sebaceous cyst from his neck under local anesthetic 2 hours ago. The patient is now at the surgery unit. The patient is quite anxious and worried that he may experience the pain in the next few hours. So the background patient has past medical history of depressions and a smoker. Patient has have no known allergies. And then assessment, I have done the observation on a patient, and inspiration was 12. His respiration was 12 of oxygen. His saturation was 99 on room air. His blood pressure was 125 over 85. His pulse 71. The patient was alert because he can tell me where he is and which ward he is. And then the temperature was 37.1, new score 0. So continuously monitoring patient blood pressure at a minimum of 12 hourly. And then recommendation, can you please review the patient, and can you please prescribe of the pain medication for patient to take home with? Because patient may request to you that I'm in so much pain at the moment. Is it okay? You ask the doctor to prescribe me with pain medication for me to go home with. As you know, he at the day surgery unit, so it means he will be going home. He will be sent home soon, yeah. And but not you, of course. You know a student nurse, you not make the decision the patient can go home or not, but um you just ask the doctor to prescribe patient with the pain medication to take home with in case patient get sent home. If they not get sent home, they stay overnight, and they can have it overnight after it been prescribed. Another thing is when patient been admitted to the ward, sometimes it's a nurse and student nurse duty that need to check patient's skin, so you can do this when you first changing the patient when they got to the ward. When patient been transferred to the ward from a different ward or from a different hospital setting, you first need to check patient blood pressure, do the observation, do their property checklist, do check their skin, check their blood pressure, check their skin, do property checklist. The patient been admitted to your ward, to your bay from a different ward or from a different hospital setting, So on that observation can be done. But during the OSCE, you can mention about can I check your skin as well? Nothing wrong with that, But mainly OSCE is your ABCDE assessment and your S-bar 2 assessment. That's your OSCE exam. But if you want to mention about can I check your skin to the patient, it's just a little bit of extra, It's not gonna harm you from mention that, Yeah, so put it in order when you got your new chart when you got your new chart in your hand. You write your name, your student number. You write the full name of the patient date of birth, the date of admission, the date that you gonna do the observation on patient and the time, and make sure you fit them in the little box. Yeah. So if your pen it's a little bit too big, you can change it to slightly thinner, so you can do the small writing and fit them in the box. So put them in order for the assessment that we need to do on the OSCE. A, B, C, D, E. A and B is airway and breathing, oxygen, respiration, saturation, oxygen. You will not be assessed on saturation scale 2 for your OSCE, because the scale 2 only use under the direction of a qualified clinician. At this scenario, you only student nurse, so you will not be using this as a part of your OSCE exam, because it's scale 2 only used under the direction of a qualified clinician. If you want to ask me why we're not using scale 2 on our OSCE exam, that's the reason for it. So we only use scale 1 on our OSCE exam. And then C is circulation. So you got blood pressures and you got your pulse. And then D, which is level of D is check disability, so level of consciousness. So you check if patient is alert, confused, respond to voice, respond to pain, or unconscious. Yeah. So ACVPU, that's to check disability or consciousness level. And then last thing, exposure. So you check the temperature to see if patient has been exposed to any infection or not. So if you remember COVID, everywhere you go, before you enter your hospital area, you have to check your temperature to see if you've been exposed to COVID or not. Normally with COVID, you've been exposed to COVID, you got high temperature. And then after if you check and you got high temperature because you've been exposed to COVID, then next thing is you got to have your lateral flow testing done. And then antibody check done after, and so on. But nowadays you don't have to do that now, because you have your COVID vaccine as your routine vaccine alongside your flu vaccine nowadays. So every October, every October, I will have my flu jab and my COVID jab. So it's part of my yearly routine vaccination now for COVID-19 vaccine. And then for your SBAR 2, one more time. SBAR 2 stands for Situation Background Assessment and Recommendation. So situation, you mention that who you are, your identification, yeah, and then patient detail, location, and what is your concern. So your concern, maybe in this scenario, the patient is quite anxious and worried that he may experience the pain in the next few hours. And then background is relevant history and event leading to assessment. This could be patient past medical history. In this scenario, patient past medical history is depression and smoker. So he was a smoker and he has no known allergy. And then assessment, you done on the patient, it could be the pain assessment, could be finding of the systematic assessment. In this scenario, we're using the vital sign assessment, which is blood pressure, heart rate, pulse, yeah, respiration, temperature, yeah, level of consciousness, and then better patient breathing on room air or oxygen. And then recommendation, if it could be any patient wish. In this scenario, patient wish is patient want you to ask the doctor to prescribe her with pain medication for her to take home with. So then you have to add patient wishes on the recommendation. And a recommendation, it could be complaint. If a patient may be complaining. Patient may be complaining. I'm waiting for doctor for 5 hours. Still have not been seen. You know, can you call the doctor again? Then you need to do so. Yeah. And then it could be can you also ask the doctor as part of the recommendation, can you please review the patient? Can you please prescribe of the pain medication for patient to take home with you? And then recommendation of any other assessment that could be done, you know. So when you checking patient that come back from the surgery, you always have to ask, are you in pain? Yeah. Are you in pain when patient come back from the surgery? Are you in any pain? You know, how bad is the pain? Can you score 1 to 10? Yeah. That's a must when you have patient come back from the surgery. Yeah. Because imagine yourself, you got cut on your body, you're gonna feel aches and pain. Patient is the same. Your patient is the same as you yourself. You know, when they got cut on their body, obviously they're gonna feel ache and pain. So you have to ask them, "Are you in pain, sir? You know, how bad is the pain? Can you score your pain 1 to 10? You know, 10 is very bad. You know, 1 is like a bearable, 1 or 2, 3 bearable. You know, 10 is very bad. You know." So good luck to everyone on the OSCE exam next week. To my classmate at the University of West London, I just would like to share with you today why the tutor said, what have you done today? It is a pass. So I hope we all will get a pass together. So thank you very much for watching, and I will see you in the next video. Have a good day. Bye bye. Bye bye.